According to WHO, since the beginning of 2017, Kenya has had an upsurge of cholera outbreaks. In the same year, 3,967 people contracted cholera, 76 people died. We are going to discuss about cholera. I am joined by Dr. Karama, who will inform us more on what cholera is and what it's all about and its prevention and cure. Glad to have you back again on our show. This time, please, could you talk to us about cholera, please?
Thank you very much. I'm also glad to be here again and to discuss about cholera. Bismillahir Rahmanir Rahim. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Amma ba'd. I am glad that you chose this topic of disease cholera, commonly referred to as kipindupindu in Kiswahili. This is a disease that really reflects the poor hygienic status of the people. Cholera is a diarrheal disease that is transmitted, is caused by a bacteria. This bacteria is known as cholera vibrio. This disease has a historical linkage with the global wave of cholera outbreak. There are about 6 waves since the onset of this disease, or historically from the beginning, when it started in Southeast Asia, then to India, and to Kenya. In Kenya, this disease was first, there was the first outbreak in around 1971 in Turkana region of Kenya. This outbreak was not linked to any local outbreak of the disease, and it was therefore associated possibly with the global outbreak of cholera from other parts of the world. Okay, so when the disease occurred in 1971, it affected a number of local communities in Turkana, and then it spread to other parts of Kenya. It went into Nyanza and then Western Kenya. This is the only recorded time that we had cholera outbreak. Before then, we had not documented. It might have been there, but maybe it was not documented as cholera as such, as technology had not developed so much. The disease is actually, now that people are quite advanced, it comes in 2 different species. One is cholera, subspecies that is known as Ogawa, and the other one is known as Inaba. Now, these are the different species that coexist in an infection. And when somebody gets infected with the vibrios, then the symptoms that are manifested is a diarrhea, watery diarrhea. This, when it occurs, it can kill very fast because somebody gets dehydrated, and then even children or even adults may lose their life. It will affect children more and the elderly. But at all times, it's a very watery diarrhea, like rice water or something like that. It's very clear that it is, you cannot mistake it with other. It's profuse. Somebody diarrheas continuously. Now, the vibrio, fortunately, with this disease, the only mode of transmission of cholera is through the mouth. You don't get cholera through contact, you don't get cholera through injection or something. It's just what you touch and what you put in your mouth. in which case then it is a very highly preventable disease. It should not occur at all. But now it's occurring in Kenya, in many parts of the country, simply because the hygiene standards of the people have gone down. And in areas where cholera is occurring, it's actually the quality of life of the people, because we refer to cholera as a hygiene disease. If people maintain their hygiene, then they would not have problems with cholera. How does cholera occur? I think one of the ways that cholera occurs, it's the hand to mouth. If you touch any food or any substance that is contaminated with the vibrios, and then you put in your mouth, or you touch food without washing your hands, which is contaminated, or your hands is contaminated by somebody, you shake hands with somebody who has the vibrios, and then you eat those bacteria, then you get the disease. And once you get the disease, there are specific things that are likely to be contribution to this. For example, in areas like Mombasa, they have these shallow wells at very close proximity to pit latrines in the households. So this is one of the contributing factors. The second thing is there's a lot of, in primary schools, they sell ice. If this ice, when you take ice, you believe this is clean water or something, because the water is already colored. So even if it was dirty, you will not see it. So ice that is made and sold to school children or to other places could also be a transmitting factor. Food and drinks that are eaten from the streets, or fruits and salads that are eaten before they are washed, could be a factor that contributes to the transmission of cholera. Now, once somebody gets cholera, the symptoms are, first of all, you get that watery diarrhea. It goes with vomiting, and the vomiting is continuous. And then you can imagine how much body fluids you lose. And people die because of losing the body fluids. Other symptoms is that you have rapid heartbeat. Actually, with those symptoms, you can be able even to clinically diagnose cholera. And then somebody who is dehydrated also loses elasticity. The skin doesn't go back when you pull it. So the elasticity of the skin is lost in people who have cholera. And then you feel very dry. Your mouth, your nose, your throat, you're always dry, and you feel thirsty all the time. Then you could also have muscle cramps. You feel muscles pulling and so on. So those are symptoms of cholera. The treatment of cholera is also very fast. The best way to treat cholera is to make sure that you retain the body fluids. So if somebody has any diarrhea, not only cholera, any diarrhea, the best treatment is to ensure that somebody is getting a lot of fluids back in whatever form. Maybe juices or tea or porridge or something. That will help a lot. But also the best thing is to rush such a person to hospital, where they can get also infused with the fluids that can help him balance the body electrolytes in the system. And so that we also have antibiotics. But many medical doctors also make a mistake of starting with the antibiotics. And sometimes we lose people because the rehydration is the most important component that can even be started at the homes. Okay. Now you find that why is this disease common in certain areas? You will find that it appears quite often in areas with poor standards of hygiene. For example, one of the way to prevent cholera is to make sure that all the drinking water that you take must be certain. Yeah, you have to be sure that the water you drink is clean. And we don't have to boil the water. You only warm it. Actually, at 70 degrees is sufficient to kill all the bacteria. And this is when the water starts bubbling, because when you boil the water loses the taste. So you need just to do that to make sure that the water you use is treated. And sometimes this bottled water in the streets also is not clean enough. People believe mineral water in the streets could be clean. It is better to have your own treated water than to buy some of those. Then whenever you're taking, like you go to weddings and there is food and there is kachumbari, those are the most risky foods that are eaten raw. They are most likely to be contaminated with the Vibrios. So that is something that we need to do. Also fruits, for example, you should not eat fruits without washing, or the street fruits that are already cut in pieces, melons and so on. These are a big risk, because these people the vendors, they don't have sufficient water or clean items to be able to do that. Then it is also important to ensure that even in the domestic area, you only eat food that is warm, or food that don't eat food that has been kept overnight and then you eat it directly. It could have also grown with the Vibrios. So in all, cholera is a deadly disease. It can kill very fast, but it is equally very easy to manage and treat, and it is highly preventable. So nobody should be getting cholera in this time of our development in Kenya after 50 years and more of independence. Nobody should get the disease cholera. However, because again of poor management of our sanitation, waste management is a big problem in all our cities. All right, so they have breeding of flies. These flies do not transmit infection, but they are the physical carriers. They carry the bacteria from one place to another. Okay, so exposure to this, we need to keep our food covered. We need to keep, if there is diarrhea, then we need to get diagnosed very fast, and the treatment should go very fast, and then we should be able to prevent this disease. Currently in Kenya, it is spread in a few counties. It's in Murang'a, it is in parts of Nairobi, it is in other areas. And the death rate of this disease is increasing in health facilities because of poor management. But it should not be more than 1%. But somehow, because of poor management in health facilities or delayed sending patients to hospital, then we get into such problems. Otherwise, I would say cholera is a disease of dirt, unhygienic areas and so on. So we must maintain our standards of hygiene, especially Muslim communities where they are. We should not be getting this disease.
Why is cholera more prevalent in urban slums?
Thank you very much for that question. In urban slums, the services, sanitary services, water supply has been outstretched. For example, in Nairobi, what the area is called Eastlands, we have very old water pipes. And what happens is that when the water pressure, because there's no adequate, as you know, that Kenya is a water scarce country, and so are the urban areas. So when the water level in these pipes is very low, there is external pressure. So there is high contamination of the very old lead pipes that were there. So water from the outside goes into some of these pipes in certain area because people try to steal water by bypassing and making their own connections. So they contaminate even the tap water. So it is easy to get cholera even from the tap water in the city councils and other places. So that's why we get to this problem. And then water could also be clean at the water source. But at the point of consumption, it gets contaminated, either through the containers that are used, or through the handling, or through the methods that people use. In the past tulikuwa na zile tukiziita kata. Kata ilikuwa ndefu, alafu ule mkebe uko mwisho huko, so watu wakiteka maji kisha wakitia kwenye kikombe. That prevented people from contaminating. Lakini siku hizi utakuta kikombe kile, mtoto anatia kikombe na mkono wake pia ndani ya maji ndio apate kuno. Kwa hivyo kubadilika pia kwa system zetu zinachangia sana. Jambo la pili ni kuwa katika Kenya chini ya watu 15 kwa 100 wanaosha mikono yao baada ya kutoka chooni. Kwa hivyo aidha kwa upungufu wa maji au kwa kutojua. Kwa hivyo hii pia inachangia sana kuongezeka kwa maradhi ya kipindupindu katika jamii. Naam.
Is there any seasonal patterns in relation to cholera outbreaks?
Yes, this is a very good question. In the past, we used to see quite a bit of cholera after the rains. For example, we have 2 rainy seasons. We have the long rains and the short rains. The long rains coming around March, April. And then we have the short rains coming maybe in October, November or so. And we used to see quite a bit of cholera outbreaks in different parts after the long rains. This means that the cholera vibrios are washed from different parts, and then there's a lot of surface water carrying a lot of vibrios all over. So we used to have quite a bit of seasonal patterns in cholera transmission. But this may not be the situation currently. We may have cholera within the environment, so that it is only the time when contamination occurs, then we are now having cholera not in a seasonal pattern anymore as it used to be, because of also the lowering standards of hygiene in the community.
What is the death rate among persons infected with cholera?
Yes, we have seen a growing trend in this, that according to the guidelines by the World Health Organization, there shouldn't be more than 1% deaths. And that is maybe caused by the delay in people sending the patient to hospital or doing any intervention. So you find that then 1% is acceptable. But recently we have seen many people dying of cholera because of also poor management in health facilities. And it is also important, we have what we call nosocomial infection. Nosocomial infection is infection people pick from the hospitals. You go there with a different problem, you end up picking cholera because the patients with cholera are also kept with other patients, or they're kept in a ward of their own, but there is a linkage with other departments of the hospital. So it is important that when we have cholera, that we have cholera wards separately, or even cholera treatment centers outside the main hospital, because every fluid that comes from that person who is infected with cholera vibrios will contaminate, will infect other person. The vomit, the diarrheas, any other body fluid will be able to contaminate people or contaminate food or contaminate whatever. So the acceptable death rate level, and for acceptable reasons, is about 1%. But recently we have seen up to 8 or 9% death rate from cholera, which should not be accepted in this time of technological development. Secondly, also, the challenge that is there with cholera, which I may wish to say, is that when we have about 10 cases, we have about other 90 cases which do not exhibit any symptoms. And this is a big risk for transmission of the disease. Also, that we have what we call the bacterial resistance, treatment resistance. Because of misuse of treatment, people treat themselves in their homes. You have diarrhea, somebody goes and goes to the chemist and doesn't even know the name of the antibiotic, but they say kuna ile dawa ya manjano na nyekundu, kapsuli hivi na vile, and then you end up eating half of that or taking half of the treatment. Now when you are treated properly, then the medications doesn't work. So you are likely to lose life. So one of the instructions also is that we should avoid self-treatment in the homes, because then we create more problem than a solution. So sometimes you might find even some of the people, the elderly and whatever, losing their life because of diarrhea and because the treatment that is given is inadequate. Yes.
We're going to stop there. Thank you so much for your knowledge.
Thank you very much. I hope that this was useful to the listeners and to the viewers of this program. Thank you very much.
Remember, an ounce of prevention is better than a pound of cure. And for Health Matters, I am your host, Naima Abdul Wahab.